Hello, I'm Sarah Singer with Maryville University. Today I'll be doing the head-to-toe assessment. My husband Patrick is going to read the video release statement as I scan the room.
I, Patrick Singer, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for education purposes or purposes that support the mission of the university. I understand that the following information will be gathered by Maryville students as part of their course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student shell for access by faculty and students at Maryville University. I further acknowledge that since this recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any of their devices as soon as it has been reviewed and graded by the instructor.
Okay, I'm going to begin the exam. Hello, my name is Sarah Singer. I'll be your nurse practitioner today. Today we're going to do a head-to-toe assessment. I'm going to make sure that I've washed my hands and that I've provided a private space to do the exam. So, Patrick, we're here today. We're going to do your head-to-toe assessment. First, I'm looking at your head. Do you have any tenderness?
No.
Okay, I'm looking at the back of your head. There's no masses, no indentions, no deformities. I'm looking at the skin on his scalp. There's no lesions. His hair growth is even, and he has, his skin is pink and warm and dry. The next thing that I'm going to be looking at is his face. I'm looking for any swelling. Do you have any tenderness?
No.
Okay, I'm going to palpate his sinuses. Do you have any pressure on your frontal or maxillary sinuses?
No.
Okay, his face is symmetrical. His eyebrows, palpebral fissures are symmetrical. I notice he has no discharge from his lacrimal apparatus. His sclera and his conjunctiva are white. His pupils, his iris, and his lens, they are round, symmetrical, and clear. At this point in the exam, we are going to do part of the neurological exam by examining all of his cranial nerves. Cranial nerve number 1 is smell. Go close your eyes. Tell me the smell.
Vanilla.
Okay. Cranial nerve number 2 is for visual acuity. I'm going to use a modified Snellen chart. I'm going to stand back about 6 feet, cover one eye, tell me what you see.
LTFPH.
AI, please.
LTFPH.
Okay. Also, I'm going to be testing his peripheral vision by confrontation. If you'll cover an eye, please. Tell me when you see my fingers.
Yep. Yep.
Okay, other eye.
Yep. Yep. Yep.
Okay. If you'll take off your glasses, I'm going to examine his eye with my ophthalmoscope. I'm turning it on to make sure it works. If you'll face me, I'm going to make sure I do his left eye with my left hand. First thing I want to do is check for his red reflex. Okay, I find it, and then I will go in close his eye, and I'm looking for his optic nerve, his retina, and his macula. Those are intact. Then I do his right eye. I find the red reflex. I go in close, and I'm looking for the optic disc, macula, and retina. Those are all intact. Okay, also I'm going to check his pupillary response to light. If you'll look at my nose, I'm going to shine a light into your eye. I'm looking for direct and consensual pupillary response, which I see. Next, we're going to test for accommodation. If you'll watch the tip of this pen as I bring it in close to you, his pupils do constrict as accordingly. Okay, the next thing that we're going to do is cranial nerves 3, 4, and 6, which is extraocular movements. If you'll look at the tip of this pen, only moving your eyes through the 6 cardinal fields of gaze. I'm looking for nystagmus, any lid lag. His eyes are moving symmetrically and very smoothly. Okay, cranial nerve number 5 is facial sensation. Close your eyes, tell me when you feel a touch.
Yep.
Okay, this, you can open your eyes, open your jaw and shut your jaw. Okay, no popping there. Cranial nerve 7 is facial movement. You can puff out your cheeks, raise your eyebrows, and smile. Okay, good facial movements. And number 8 is hearing. So I'm gonna come behind you. If you'll cover your ear with your hand, I'm gonna whisper a word.
Summer.
Okay, other side.
Winter.
Okay, his hearing is intact. Cranial nerves number 9 and 10 are glossopharyngeal and vagus. I'm going to use my tongue depressor, stick out your tongue, say ah. Okay, his uvula rises as it should, and his gag reflex is intact. Cranial nerve number 11 is neck and shoulder movements. You can shrug your shoulders, move your neck from side to side, and look up and down. Okay, number 12 is tongue movements. If you can stick out your tongue and move it left to right. Okay, and then that's all of our cranial nerves. The next thing that we're gonna test, we're gonna look at is your mouth. You'll stick out your tongue and move it side to side. Okay, no white patches or lesions on his tongue. It is pink. And then I'm going to shine my light in your mouth. Okay, your oral mucosa is pink. Stick out your tongue. Tonsils are intact. No bleeding or discharge from your gums. No white patches, and your teeth are intact. Your lips are with no lesions, and they are pink and moist. The next thing that I'm going to look at are his ears. So when I look at the front of your face, your ears are symmetrical and in line. I'm looking at the outside of his ears. Everything is pink and warm and dry. There's no discharge, and there is no foreign bodies. Next, I'm going to use my otoscope, and I'm going to look inside. Okay, I see that his tympanic membrane is pearly gray in color. There's no discharge. I'm looking in the other ear, and his tympanic membrane is pearly gray in color with no discharge. The next thing that we're going to do is we're going to look up his nose. First, on the outside of his nose, I'm noticing that both nares, there's no obstruction. He is easily breathing out of his nose. I'm going to look up with my light. I notice that everything is pink. There's no discharge. There's no polyps. There's no septal deviation. Okay, so the next thing that I'm going to be doing is feeling for his trachea and his neck. His trachea is midline, not deviated. Now to your back, I'm going to palpate your thyroid. Okay, intact, swallow. Okay, no changes when swallowing. The next thing that we're going to do is feel for your lymph nodes. We've got preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical chain, supraclavicular, axillary, epitrochlear, and femoral. Do you have any tenderness?
No.
Okay, he has no tenderness and no palpable lymph nodes. The next thing that we're going to do is move on to his heart and lung assessment. If you want to go ahead and take off your shirt. Starting with the lungs, I notice that he is pink in color, no cyanosis. He is breathing regularly and no retractions, no use of accessory muscles. And so I'm going to palpate his chest. Any tenderness?
No.
Okay, say 99.
99. 99.
Okay, on your back, say 99.
99. 99. 99.
Okay, there's no fremitus. Now we're going to test for lung expansion. I'm gonna hold my hands down here. Please take a deep breath. Okay, and out. Okay, I notice that my hands do like this as they're supposed to when he takes a big deep breath. The next thing that we're gonna, I'm also inspecting is his AP and lateral diameter. His AP diameter is less than his lateral diameter. So the next thing that I wanna do is percuss his chest. So I'm going to percuss in his intercostal spaces, starting under his clavicle. I'm listening for resonance. I'm going to do that on this side, starting under the clavicle. Also listening for resonance. I'm also going to percuss on his back. All areas of resonance. I'm also going to percuss for his diaphragmatic excursion. So if you'll take a big deep breath in and hold it. I'm percussing down for areas from resident, you can let it out, to dullness. I'll mark that spot. Now take it, now breathe out and hold it. Okay, now breathe. His diaphragmatic excursion is about 3 centimeters. So now what I'm going to do is I'm going to listen to his lung sounds with the diaphragm. Let me start in your front. Okay, take a big deep breath in. Okay, now I'm going to listen on your back. Okay, his lung fields are clear. I hear no adventitious sounds. The next thing we're going to do is some special techniques where I listen. If you can say the word E every time you feel my stethoscope.
E, 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 E.
Okay, good. Now if you will say the word 99, this is bronchophony.
99, 99, 99, 99, 99, 99.
Okay, the first one was egophony, that was bronchophony. Now we're going to do whispered pectoriloquy. If you can whisper the word 99. Okay, his voice does not change as I listen, and that is a normal finding. The next thing that we're going to do is his cardiac assessment. So I need you to lay down. Okay, as he lays down, I am looking for jugular venous pressure, also for carotid pulsations. I'm going to palpate his carotid pulses, make sure that you don't palpate the carotids at the same time. Those are present +2. I'm also going to use the bell of my stethoscope to listen to his carotids. Okay, no bruits noted there. Now I'm going to palpate his point of maximal impulse, which is at the 5th intercostal space, mid-clavicular line. Okay, and I feel that. The next thing that I'm going to do is I'm going to be listening to his heart tones. So I'm going to come over to this side. First, I'm going to use the bell of my stethoscope, and we're going to listen to his heart tones. We've got aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, his heart tones have no murmurs. Now I'm going to do the same thing using my bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. I hear no murmurs. Also, I would like to note that S2 sound is greater than S1 at the base, and S1 is greater than S2 at the apex. Now, if you will lay on your left side, this is the left decubitus position. I'm going to be checking for mitral stenosis, listening at the apex. Okay, no murmur there. Now I'm going to have you sit up. Okay, if you can lean forward, breathe out and hold your breath. Okay, also listening at the apex. And that is no murmur, so that's negative for aortic stenosis. So the next thing that I'm going to do is I'm going to palpate his pulses, feel his radial pulses. Okay, they're present +2. Brachial pulses, present +2. I'm going to have you lay back to feel your lower extremity pulses. Okay, here's the femoral pulse. Femoral pulse, present +2. Popliteal pulses. Okay, present +2 on both sides. And then his posterior tibial pulse. Okay, those are present +2 on both sides. Now his dorsalis pedis pulse on the top of his foot. top of this foot, both pulses present times 2. The next thing that I'm going to be doing is looking at his legs. Both his legs are pink, they are warm and dry. His feet are warm and dry and pink. They're symmetrical in size, equal hair growth and hair distribution, and he has no swelling in his legs or on his feet. So I'm going to sit up, have you sit up. We're going to do an Allen's test on your wrist. If you'll hold your wrist out for me. I'm going to occlude the ulnar and radial arteries, pump 3 times. Okay, now open your hand. When I release, your hand turns from white to pink. Okay, same thing, including these arteries, bump your hand 3 times, hold it. Now open it, it is white. When I release those arteries, his hand turns back to pink. So now, if you would like to put your shirt back on, this is the skin and abdomen assessment. I've already checked the skin on his scalp. He's got no lesions, it's warm and dry. The skin on his legs is warm and dry. And I'm looking at his abdomen. I'm palpating. Also, I wanted to palpate his chest. Did you have any tenderness?
No.
Also, he has no lifts or heaves. I'm looking for any abnormal pulsations, any abnormal movement, which I don't see any. So the next thing I do on the abdomen is I listen. So I'm going to auscultate with my diaphragm in all 4 quadrants. Okay, he has normal active bowel sounds in all 4 quadrants. Also, at this time, I'm going to switch to my bell. I'm going to listen at the arteries in his abdomen, listening to the abdominal aorta, renal arteries, iliac, and femoral. No breweries. It's important to use the belt of your stethoscope when listening to arteries for any kind of breweries, which he has none. The next thing I'm going to do is percuss all 4 quadrants, and I want to hear sounds of tympani, okay, which I do. Then I'm going to percuss his liver span. I listen from when the sound changes from tympani to dullness. I would estimate his liver span to be about 10 centimeters. I also percuss over here to make sure that he does not have splenomegaly. Then on your abdomen, the last thing that we do is palpate. So I'm going to start with light palpation in all 4 quadrants. Let me know if you have any tenderness. Any tenderness?
No.
Okay, no masses or anything felt there. Now we're going to do deeper palpation, all 4 quadrants. Any tenderness?
No.
Okay, also no masses felt there. Also, I'm going to percuss or palpate for kidneys. Okay, any tenderness?
No.
Okay, I'm going to palpate your liver. This is Murphy's point. Take a big deep breath in. Okay,
No.
you can breathe. Okay, no pain there, so that's a negative Murphy sign. We're going to do some other special tests for his appendix. The first one is McBurney's point. Any pain there?
No.
Okay. The next one is rebound tenderness, Rosvig sign. I'm going to press on his left and see if he has any pain on his right side. Any pain on your right side?
No.
Okay, good. The next is the SOAS test. I'm going to hold down your left knee. Try to raise it up. Any pain there?
No.
Okay, that is negative. The next one is the obturator test. I'm going to raise up his leg, rotate it in. Any pain?
No.
Okay, so all of those tests for attendance are negative. All right, now we're going to sit up. Now I'm going to check you for CVA tenderness, see if you have any tenderness in your kidneys. So back here at your costovertebral space, I'm going to use some force. Did you have any pain there?
No.
Okay, so the next thing that we're going to do is his musculoskeletal exam. I'm going to have you move up to this chair. So in the musculoskeletal exam, I'm also going to be doing some of the neurological exam because I'm going to be testing for muscle movement and muscle strength. So the first thing I'm looking at is his neck muscle movement. If you can look up and down, side to side. Okay, now I'm gonna have you stand up. I'm looking at your shoulders. If you could shrug your shoulders up, okay, down. And I'm looking, his shoulders are symmetrical, no lesions. What I'd like to do now is a test for rotator cuff injury. This is the drop arm test. Raise this arm out to your side, let it drop slowly. Any pain?
No.
Okay, this side, any pain?
No.
Okay, the next test for rotator cuff injury is the infraspinatus. Arm at 90 degrees, force out on me. Any pain?
No.
Okay, any pain when you force out?
No.
Okay, those are both negative for rotator cuff injury. So the next thing that we're gonna do is your back movements. If you could bend down and touch your toes. Okay, good. Lean back as far as you can. Rotate from side to side. And then do like this. Twist. Okay, good. Now I'm going to be looking at your spine. The curvature of your spine is straight, no curvature. I'm going to watch your gait. If you could just take a couple steps back that way and then come back. His gait is smooth, it's symmetrical, and he has good range of motion. The next thing I'm going to have you do is sit back down. Okay, with your elbows. Let's see you bend those down and up. Now abduction out and adduction back in. Okay, good. That's good movement. Now we'll test with strength. Try to come up on me, on my arm, okay. Okay, good strength. Now I'm gonna have you do grip strength. Okay, good. Now with your wrist, hold your wrist out, move them down and up and out and in. Okay, good. Now your fingers, put your fingers out, point your fingers up, point your fingers down. Okay, abduct your fingers. Now try not to let me squeeze them in. Okay, good muscle strength on your fingers. Okay, now on your wrist, I'm going to check for carpal tunnels. So I'm going to tap your median nerve. This is the Tinel test. Do you have any numbness or tingling?
No.
Okay. The Phalen's test. Any numbness or tingling there?
No.
Okay, he is negative for carpal tunnel. The next thing that we're going to do is we're going to check the muscle movement and strength of his hips and knees. I'm going to have you go down face down. Okay, bend your knee up. Now lift it up. Okay, good hip movement and good hip movement. Okay, now come back around onto your stomach. Okay, now pull your knees into your chest. Okay, good movement there. Now also, while I'm looking at his knees, I'm looking for a fusion. The bulge test. I do not feel any fluid above his kneecap. The ballottement test. If you push on either side of his kneecap, I do not see any kind of floating effusion. Anything that indicates fluid in his knees. The next thing that we're going to test for is meniscus and ligament damage in his knees. For the meniscus, that's the McMurray test. I'm going to bend up, rotate in, any pain?
No.
Okay, this side, rotate in, any pain?
No.
Okay, for ligaments, we're going to do the anterior posterior jaw test. Okay, any pain?
No.
Okay, down on this side. Any pain?
No.
Okay, the next one we'll do is the valgus varus test for ligament damage. I'm gonna raise up, I'm gonna rotate in, rotate out. Any pain?
No.
Okay, on this side. In and out.
No.
Any pain? Okay, I'm also gonna have you abduct your legs. Okay, put them back in. Okay, now with your feet, put your feet towards you. Now point your toes. Okay, good. Now try to come back. Okay, now push your feet like you're pressing on the gas. Okay, I'm gonna have you come back up to the chair. Okay, now I'm gonna try to have you kick your shins out. Okay, now kind of come back down. Okay, he has good muscle movement in all of his muscles, and he also has good muscle strength. So, moving on to the neurological exam, we've already done cranial nerves and muscle strength, so we're going to do coordination. So I'm gonna have you close your eyes and touch your finger to your nose. Okay, good. Now I'm gonna have you touch your heel to your shins. Okay, that is good. Now stand up. Testing your balance, we're gonna do the Romberg side. Romberg test, you start with your eyes opened, hands at your sides. Now close your eyes. You would watch for about 30 seconds, you can open. For any swaying or trouble standing up, he has none. The next one is the pronator drift test. Hold your hands out, palms up. Now also close your eyes. I'm looking for any swaying, and he is steady. Okay, you can open your eyes. Now I've already assessed his gait. He has good balance when walking. Now you can sit back down. Okay, now we're gonna do some sensory testing. I'm gonna have something sharp and something light. Please tell me if this is light or sharp touch. Close your eyes.
Light. Sharp. Light. Sharp.
Okay. Next thing we're gonna do is temperature. Tell me if this is hot or cold.
Cold.
Okay. And then do you feel a vibration?
Yes.
Okay. The next thing I'm gonna do is please close your eyes. Stereogenesis. I'm gonna put an object in your hand. Tell me what that is.
Remote.
Okay, good. The next test is graphesthesia. I'm gonna write something in your hand. Tell me what it is.
S.
Okay.
8.
Okay, good job. The next thing that I'm gonna do is 2-point discrimination. So this has 2 points and 1 point. Please tell me if you feel 2 points or 1.
2. 1. 2. 1.
Okay, good. The next thing that we're gonna do is point localization with your eyes shut. I'm gonna touch a body part. Please tell me what I'm touching.
Elbow. Knee. Elbow.
Okay, good job. The next thing that I'm gonna do is I'm gonna get my reflex hammer, and we are going to test his reflexes. The first reflex we'll test is the bicep. Okay, let me get behind you so you can kind of see. Also the tricep. Okay. Over here, tricep. Okay, now we'll do the brachioradialis. Okay, brachioradialis. Okay, now if you'll dangle your legs, we're gonna do the knee jerk. Okay. Okay, now I'm gonna do his ankle jerk. Okay, now I'm gonna have you lay back down. We're gonna do a couple more tests for meningeal. Okay, the first one is called the Koenig sign. What we do here is I put your leg, I'm gonna put it out straight. No resistance, any pain?
No.
Okay. Okay, any pain?
No.
Also, I feel no resistance. The next is Koenig sign. If you could put your chin to your chest. Okay, and I do not notice any other movements. Okay, you can sit back up. That completes our test. Sorry about all the dogs.